Did you know that oral habits are a common cause for braces? That's why some of us who wore braces when we were younger, we have to wear them again later in life. I want you to meet Dr. Daniel Grob. He's from Scottsdale Orthodontic Care, and he's here to show us what we can do to break those bad habits. Boy, that's a tough one. That's a big task at hand, Dr. Grob.
I'd love to help you with that, yes.
First of all, let's talk about what's new, and as far as braces and aligners. What's the latest?
In the world of orthodontics, appliances are becoming less cumbersome, they're clear, they're invisible, and now we're even accelerating treatment with procedures that can make treatment be cut in a third or even in half in many instances.
Wow, if you take a look at this woman whose photograph we have here, she's actually wearing braces, but you can't even see that.
Right, she's wearing a brand of clear aligner known as Invisalign. A lot of the people are familiar with that. And the fella on the other side is wearing a brand of clear braces called Clarity, and they're ceramic, and both of those patients are our patients, and they're wearing clear appliances.
And that's what's so great about it, is you can continue, you know, your everyday life. Most people don't even know or can't even tell, which is what a lot of adults really want. I want to talk about what you call, and I think this is brilliant, you call it Face First Orthodontics. What does that mean?
Face First Orthodontics is the practice that emphasizes face muscles, tongue muscles, and elimination of habits in order to help correct treatment, move teeth faster, and make them stay straighter longer. These are examples of patients that had oral habits. Thumb sucking, for one, causes the patient to get a better smile. That big gap in the front closes down by just removing the thumb from inside the mouth.
So that person, looks like a young person there, was able to get their teeth aligned just by stop sucking their thumb?
The first step was stopping sucking the thumb.
Wow, okay. How important is it to recognize that this is really a problem?
Well, I've been in business for well over 25 years. And when I started seeing patients come back after multiple years of wearing retainers, and some of them started to develop crooked teeth again, they had to be put back into braces, I started thinking, I think habits are really important. And we're all taught this, it just takes many years to recognize the influence of oral habits on the smile.
All right, so what are we looking at here? What is this represent? What is this telling you?
This shows us how the tongue is behind the teeth, the lips are on the outside of the teeth, and the teeth are in the middle. So what we're trying to do is position the teeth in between the face muscles and the tongue muscle. This young girl stopped nasty oral habits, and you can see her nice relaxed appearance on the right is much better and beautiful than her rather stressed appearance on the left.
And when you say oral habits, it could be thumb sucking, nail biting, what else?
Tongue posture, sticking your tongue between your teeth like this patient here. We had to teach this young woman how to remove her tongue from between her teeth as a habit. And once she did that and we applied treatment, she got a beautiful smile. Notice how much wider her smile looks.
It's gorgeous. I can't believe the difference. And Jason, he's got our handheld camera here, and I want to show, this is one of the devices that you help people actually change their actual face structure.
That's right.
And why is this important? Come back here, Jason.
This is a nice reminder device. We give patients in our practice classes.
What does this do?
That's where the patient places their tongue, which reminds them to place their tongue on the roof of the mouth, which helps the smile get bigger and broader.
And then these little bumps right here?
Those little ridges encourage the patient to hold the appliance in the mouth, which strengthens the lip muscles, which help the teeth position themselves in the right spot.
Thank you, Jason. And then very quickly, tell everybody at home, when should we begin this type of treatment? At what age for our young ones?
It's important to be evaluated young. After the first permanent teeth erupt, 6 or 7 is a good time.
Okay.
We almost always take a screening x-ray to show the patients how the teeth are developing. And we oftentimes find extra missing and malformed teeth at that age.
All right, that's why it's so important to have an evaluation. And Dr. Grob is doing that today as his special offer. It's a complimentary evaluation and a free oral habit device. That's one we just showed you, with classes on knowing how to use it. Scottsdale Orthodontic Care is located at 4910 East Greenway Road. That was a tough one. Greenway Road. 480, thank you. I need a device. 480-634-7731. You can learn more on his website, scottsdaleorthodonticcare.com.